Thank you for joining us here on KMR Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live for this breaking news.
Good morning. I want to start by saying this morning that I know it's getting more and more difficult to be all in. I'm seeing pictures and hearing stories of families that are separated from their loved ones at nursing homes, from loved ones who are in the hospital. And I know this is hard. And I want to tell you that you have my prayers and my sympathy as we're facing this. It's hard also for business owners who have closed their businesses in order to protect our community from this outbreak. It's hard on our essential workers who are still going out into the community and working longer hours. So I recognize that it's getting more and more challenging every single day that we are all in. Many of us are asking when we will restart the city. And I actually think how is a better question than when. And to try and answer that question, the City Council will be conducting in this next week a number of industry roundtables to sit down with community leaders and people, just normal citizens, business owners, to find out how we need to restart our city. What are the things that we need to develop as action steps so that we can safely restart our city? So from these roundtable discussions, we believe we will be able to determine those action steps, and that's where our focus at the City Council is going to be for the next week. Thank you.
Thank you, Mayor. Now go to Casey Stoughton, Public Health Director, City of Amarillo.
As of 10 o'clock, thank you, Dave. As of 10 o'clock this morning, there were 200 cases of COVID-19 reported in Potter and Randall counties. This number will change on the 2:30 report card as we have in-lab reports coming in throughout the day. We have a total of 33 recovered, which is certainly something to celebrate. Public health was notified of a fifth COVID-related death in our community, thinking about this family today. Public health department continues to work through demographic information related to death, and related to race. And currently, 51% of those who have tested positive are Caucasian, 36% Hispanic, 7% African American, and 6% Asian. Please note that these percentages will change as people continue to be tested. Drive-through testing continues today until 3 p.m. Please call 378-6300 and our call takers will screen and direct you to testing. Thank you, Dave.
Thank you, Casey. Now we're going to go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center.
Yes, good morning. Once again, I would like to please ask everyone to continue to stay at home, wash your hands, clean surfaces, generally practice social distancing, and wear a mask if you're in the community. Through the health department and in cooperation with Coffee Memorial Blood Center, we have at least 2 donors for convalescent antibodies. We'll be finalizing the paperwork today to allow for donation. More candidates for donation will become available, we believe, and encourage people to donate, as this is one treatment that seems to improve outcomes in critically ill individuals. At this time, I would also strongly encourage citizens not only in Potter and Randall County, but all other counties and communities in our referral area to practice social distancing. Also, I would ask the leaders of these communities to insist their citizens practice social distancing, wear masks, and stay at home, and generally practice social distancing. If you become ill, please get evaluated by your provider. The medical community here in Amarillo has the expertise to handle critically ill patients, and at this time we are doing okay. But our resources are limited, and if we were to surge, this would likely result in many more deaths. As time goes on, we will continue to update you on information with the pandemic. Thank you.
Thank you, Dr. Milton. We now go to Jared Miller, City Manager of Amarillo.
Thank you, Dave. Public safety calls for service remain down, with Amarillo Police Department down 9% from this time last year, Fire Department down 19% from this time last year, and ambulance responses down 6%. While those are down from this time last year, they are more active than they have been for the last week or so. It does indicate that while we are social distancing, while our community is social distancing and doing our part to stay safe, it appears that we're getting more comfortable moving around. So I would ask that as we move around, that as we go to the non-essential businesses or to our essential businesses or to take care of family members or loved ones, that we continue to be very aware of social distancing, enhanced hygiene measures, and other things to keep yourself and those around you safe. AmarilloAlerts.com is a reminder the city recently announced a new emergency notification system to provide current and factual information on a variety of events, including COVID-19. Really want to encourage citizens to continue to sign up for the service at AmarilloAlerts.com so you can stay informed. As of this morning, we have 4,187 people signed up to receive Amarillo Alerts. And the reason why we want people to do that is it's just one more tool in the tool chest. So when we're trying to get out information, when we're trying to communicate time-sensitive information, especially information about COVID-19 or weather alerts, things like that, it's just another way that we can get that information out, accurate, good information. I want to also remind everyone that drive-through testing center is still open. If you feel sick and have symptoms you think may be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. I just want to really encourage anyone, if you feel like you have symptoms, call the screening center at 378-6300. You'll get screened. If you have the appropriate conditions, they'll send you in real time your name to the testing center, so they'll be ready to take you immediately. Finally, our pet pantry. The Animal Management Welfare Pet Pantry has been extremely successful. On Thursday, April 9th, 547 families were helped. Yesterday, another 497 families were helped. Please note that the event was canceled last Tuesday due to weather conditions, but we're going to continue doing it. The program is going to continue next week on Tuesday and Thursday from 3 to 6 p.m. You can come to AMW Animal Management Welfare at 3501 South Osage to receive a free bag of cat or dog food. I want to give a special thanks to our partner, Merrick Pet Care. They've donated many tons of dog and cat food for this cause, and without a partner like that, without a friend to our community like that, we wouldn't be able to do this great service. Also want to thank all of the committed volunteers and employees who've been able to work this event and help that many people. So thanks again for the Pet Pantry. Please make note that you can get the Pet Pantry supplies next Tuesday and Thursday between 3 and 6 p.m. at the Animal Management Welfare Facility at 3501 South Osage. That's all I have.
Thanks, Jared. Now I want to just pose a couple of questions we've seen here in the Communications Department, either from phone calls, emails, social media, sources like that. This would be primarily for Mayor Nelson. I know the President detailed a plan yesterday to possibly reopen the country, and the governor is having a news conference at noon, probably along similar lines. How do you see these guidelines impacting what might happen here in Amarillo?
We clearly will submit to authority, both at the state level and the federal level, respecting those leaders. We're praying for them daily. But it is good that they're recognizing that not every city is the same. So they can't paint the entire nation or the entire state with a broad brush, because every local community has different circumstances, and their leaders know best really how their citizens want to face this situation. So I'm going to be on that governor's call at noon and looking forward to the guidance that he's going to give us. And then we will take that and submit to it, but marry it with our local data and the experts that we have here giving us advice from our medical community to make the best decision for our community.
Thank you, Mayor. I have a question for Dr. Milton. In Amarillo, the vast majority of those who are testing positive for COVID-19 are not requiring hospitalization. Is this typical for most individuals who do test positive?
For most individuals who do test positive, that is typical. As we've said before, the vast majority of individuals, probably 80 or 90%, are never ill enough to seek medical care. What we're most concerned about are those 10%, maybe 15% of individuals that get sick. And then that smaller percentage of those individuals that can get really sick. And we do have those types of individuals in our hospitals now. So what we need to stress is that this is a highly contagious pandemic and a virus, and we need to practice social distancing. That's the one way that we can prevent transmission.
Thank you, Dr. Milton. Now I want to go ahead and open it up to questions from our media. If you have a question for an individual member of the panel or the group as a whole, that's perfectly fine. If you'll just identify yourself and what media outlet you're with, I'll try to do that as well. Let's start with David Gay of the Amarillo Globe News. Go ahead, David.
Morning, everybody. I have a question for Mayor Nelson. You talked about these industry roundtables for the City Council. Can you tell me a little bit about what industries will be represented, if you guys know, and when those meetings will begin?
The first meeting is actually starting today, so the goal is to get those done in the next 10 days so the City Council, not at their next meeting, but at the next meeting, can have a very robust conversation about what we heard in those roundtable discussions and what our action steps need to be as a community to restart the city safely. Industries involved would be the realtors, our local builders association, hoteliers, large retailers, small retailers, restaurants, our nonprofit community, a separate group for our church community, banks, our oil and gas industry, our agriculture industry, and our beef and dairy industry. So really trying to pull in every single component of our local economy. And what we recognize is that this is a 100-year event. There's no playbook for this. And so every day in some ways is a gigantic experiment. We get new information, both at the federal level, the state level, both from the medical community. We're learning as we go. And so every plan we make has to be flexible and has to be constantly looping back and checking for new information, because we're still learning as we're making our plans and trying to respond to this. So it's a very unique crisis situation. It's a very extended crisis situation. And what we want is to involve as many people as possible in pushing the solution up the hill. And we feel like these roundtable discussions are going to be an effective way to bring people's thoughts and ideas around the table. But ultimately, we've got to funnel those into action steps.
Absolutely. And are these meetings where they are requested?
And we'll continue with the coronavirus coverage on air and online. And to keep up with the latest and watch the rest of this press conference, go ahead and head over to myhighplains.com. For now, let's send it back to programming.
They will be leading the roundtable discussions, and both in the content as well as choosing the leaders to be around those tables. And I have a tremendous amount of trust in our city council as they lead us through this.
Absolutely. And one question for Dr. Milton about the two donors for the antibodies. And it may be too soon to tell, but do you know how many I guess, people can be treated from those two donors? Has it been determined like that yet?
That's always variable on many times, generally the basic size of the body mass of the donor. And so, but likely several individuals per donor could be treated.
Okay, that's all I got, Dave. Thank you.
Thank you, David. Now let's go to, I think we have, is this Jack Kessler, KAMR, Channel 4?
Sir?
Yeah, Jack Kessler, KAMR, Channel 4, am I correct?
Yes, sir.
Go ahead.
All right. This first question is for Mayor Nelson. At those roundtables, what are some of the things that will be discussed, and why is it important to meet with local businesses?
The roundtable discussion will operate on a framework of questions we'll be using at the same framework for every meeting, so that will help us funnel our information better. And it's basically two components. One is a 30-day window that's getting ideas and feedback on how we can restart the city, and asking businesses and leaders, what criteria do they think they can implement into their businesses for social distancing, which is really the most important factor in keeping our city safe in this outbreak. as well as what are their immediate 30-day needs economically. And then the second component will be a longer window, an 18 to 24-month window. How do we recover economically in the city? So really those two components, what are their ideas and needs for restarting the city in the next 30 days, if that's our time frame, and then a longer view, what are their ideas and needs and opportunities do we see? I mean, everything has shifted. So we've got to set aside the way we used to do things and be willing to look with a growth mindset of, are there new opportunities here for us to grow economically out of this unexpected crisis over the next 18 to 24 months? So that's the general framework of the questions. And I've forgotten now what the second part of your question was.
Why is it important to meet with these local businesses?
Oh, they're the heartbeat of our community. They're employing all of our citizens. They're the ones taking risks to grow their businesses. They're the families that have been here for generations. They've seen tough and challenging times before. They dug in and got us through tough and challenging times before. So there's a lot of wisdom, a lot of good, strong West Texas moral fiber in those leaders. And we would be foolish not to sit down, listen, and learn from them.
And then I was going to ask you also, Mayor Nelson, the shelter-in-place order was extended the other day. What has been the response to that?
The longer we go all in, the more people have a stronger opinion. So I'm beginning to see some polarization of people that feel it's time for it to be over and people that feel even more strongly that it needs to be extended longer. So this is just going to be a challenge for us because this crisis is going to have a long time frame on it. We're going to continue to see our priorities come in conflict with each other. And sometimes that's going to be a health priority in this family is going to conflict with an economic priority in this family. So there are going to be some challenges for us as a community as we move forward. Again, I think that's why it's so important to have lots of minds and lots of opinions around these roundtable discussions. That's how we're going to build the strongest consensus about how our city needs to restart and what the action steps are for our city to recover economically.
All right, thank you, Mayor Nelson. This is one last question for Casey. How many businesses has the health department been working with to help keep the employees safe?
We want to work with all businesses to help keep the employees safe. That's our goal, is to keep all of our community safe.
I have no further questions. Thank you, guys.
Thank you, Jack. And I want to go to, I'm pretty sure I'm right here, Ariana Martinez, KFDA Channel 10.
Mm-hmm.
Yes, sir. Good morning, everyone.
Good morning. How are you?
Good. So I have a few questions. One, will the drive-through testing site remain open next week as well?
That is our goal. We're constantly working on supplies and making sure that we can keep that going. But yes, our intent is to keep that open next week. So we will be open on Monday.
Perfect. And we heard there are positives in some of our Amarillo senior living facilities. What can we do to combat that and stop that from spreading in such a place that's so vulnerable?
Social distancing and staying home are the things that we need to do in our community. The all-in order is very important, and so everyone needs to stay all in.
And if it's already in the facility, is there any worry of it spreading even if we're social distancing now?
Yes, we want to make sure that we're working with, like the question before, we're working with every business and every facility to make sure that that residents stay safe, that that employees stay safe, and that our essential workforce stays safe. And so we are working with environmental health and health and human services to ensure that our senior facilities are taken care of.
Perfect.
And I would jump in, Ariana, and say what a great job our medical community is doing. These folks are professionals. They are trained at the extra hygiene that the rest of us are learning, they do that every day, and they understand the importance of it. It's part of their habits. It's part of their systems and how they interact with patients. So I do share concern, especially for our vulnerable populations inside these residential nursing facilities. But I also have a lot of confidence in our medical facility workers and those professionals who are trained for their superior hygiene skills, actually. And certainly they love those residents that they take care of, and they are doing everything they can to keep them safe.
Of course. And then Casey, at this time, do we have any numbers as to how many might be positive in these senior living facilities?
I don't have those numbers exactly, but we can certainly get back to you on that.
Thank you. And then last question, with the recent death, do we have age and gender?
89.
Okay. Thank you. And that's all the questions I have. Thank you, guys.
Thank you, Ariana. I want to make sure we don't miss anyone here. Let me go to, I think we have a representative here from KVII, Channel 7. Do you have any questions for the panel? Representative from KVII, Channel 7. Do you have any questions for the panel, please? Okay. I think, let me go, there's one more. Again, I want to make sure we don't miss anyone here. Aaron Langston from Channel 4, KAMR. If you have any questions, you may ask them now of the panel. Thank you, Aaron. Just want to make sure we didn't miss you. Those are all the attendees we had from the media. Once again, we do these news conferences 3 times a week, Monday, Wednesday, and Friday, 11 a.m. They are on Facebook Live. We want to thank all of our panelists for taking the time to be here. Thank our media members for also participating. And again, we do these every Monday, Wednesday, and Friday at 11 a.m. And we will see you next week. Thank you.
Thank you.
Thanks.